Hi, I'm Stacy Hoppus. Joining me today is Bernick, the public health nurse for the town of Wallingford. Ann, thank you so much for being here today.
Thank you for having me, Stacy.
Wonderful. So you work for the Department of Health in Wallingford.
Yes, I do.
Where are you guys located?
We are located in the town hall
Yeah.
on the second floor in room 215.
Okay, and what are the typical hours that you're there?
Now, currently during COVID, pre-COVID, I was there on Monday and Wednesdays,
Okay.
like half days. Now that we've had to socially distance, we have more people in the office that we can socially distance in that office. So
Right.
I'm working out of the health office at the senior center.
Okay.
And I'm there 5 days a week. Again, I work part-time. I work on 19 hours, so they're half days.
Right. And what are some of the jobs that entail for you, like on a daily basis?
That's a great question because now it's never the same thing every day.
Right.
Right now, very much of it is focused on COVID-19 as well as prepping for the upcoming flu season.
Right.
So I am involved in contact tracing as well as I still continue. We abbreviate it CT-EDS. That stands for the Connecticut Electronic Disease Surveillance Site.
Okay.
So I have that site that I've always had to double check every day that I'm there to see any communicable disease. Do we have things that we have to look at even other than COVID?
Right.
When flu season is ramping up, we look and see how are we doing with flu.
Right.
So that I have that, it's just normal as part of my job. And then I also every morning go on to the contact tracing site and see what kind of contacts, cases and contacts I may have to deal with for that day.
And then why don't you run us through a little bit of the contact tracing and how that works?
The way it works is the information comes from the CT-EDS. So that gets put in, you have your lab results, you test positive, you get put into the electronic surveillance system through our state of Connecticut,
Yeah.
and then that gets pulled. I want to say now I think they're doing it twice a day,
Okay.
or it might be more than that, but I think it's twice a day, gets pulled into it's called contact, and they kind of came up with that, contact tracing and then contact CT, so it's contact for Connecticut.
Right.
So I look on I'll see my new cases, and I can, it's all computer-based. It's Microsoft platform.
Yep.
I click on the name, I get a phone number. Hopefully there's a phone number.
Right.
Every once in a while there isn't. You have to do some investigating.
Right.
And I call, and I hope I can reach the person to speak to them.
Right.
Most people, I would say we get maybe 75% people are picking up. Some people don't ever pick up. There's nothing I can do about that.
Right.
So we pick up, we talk to them, or I'm the main person doing the contact tracing, but
Okay.
several of us in the health department have been trained in this.
Yes.
So I will call, I'll say, there's a whole series of questions I have to ask. I ask them if they have a few minutes, do they mind me calling? At that point, I'll also ask, because depending on whether they're a contact or a case, they will be monitored for 10 to 14 days.
Mm-hmm.
And would you like to be opted in through a text or an email?
Okay.
So once I've made initial contact, most people will say, yeah, I'd rather just get a text from you.
Right.
But I can see those cases in my system.
Okay.
I also will ask the person if have they been anywhere 48 hours prior to showing symptoms, or
Right.
before getting tested if they didn't have symptoms.
Right.
So looking at locations, looking at other people, we're really interested in other people they may have been in contact with.
Right.
Adding them to the list and determining, are they someone who is a legitimate contact now that I need to make a phone call?
Right.
Most people do know, but not everybody does. So
Right.
it is something, and if you can imagine, sometimes it's time consuming. I think because I'm the nurse, people ask me a lot more questions than if I was just a lay person.
Right.
And I like to do a lot of educating when I'm making these phone calls.
Right. So now can you just clarify, so a contact, if we have an adult who comes down with a positive case.
Yes.
And they have children or anything like that, those are your immediate contacts.
Yes.
But now if it was in the school system, it's not like a sibling to someone that has been in contact with the person who came down with the case.
So for example, for the school, say the child was exposed, a child in second grade was exposed to like a teacher or another child or a driver or whatever,
Right.
so they are a contact of that person, but their sibling is either in a different grade
Yep.
in that school, not in the same classroom, or in a different school, or maybe not even going to school, just in the
Right.
household. They're not considered a contact.
Right.
Now, you would, if the sibling that was in the classroom, if this makes sense,
Right.
turns up positive, then
The whole family is.
Yes. So we like to say a contact of a contact isn't really. We don't really worry about the context.
They're not
of the
at
context.
as much risk.
We're getting too far down the line.
Okay. Just so I think to make that clear for everybody is really important, because I know that there's so many questions going out there. We're all on high.
Yes.
So
you want to diffuse the panic, and this is based on how the disease is spread and the science that we know.
Right.
Of course, it's an evolving disease, so we are learning as we go along.
Absolutely.
We're sort of, I've heard this expression, we're building the plane and flying it at the same time.
Right, absolutely. All right, well, on another topic, why don't we talk a little bit about some of the trainings and the classes that you guys offer?
So for me, I'm involved with, we have our MRC, so they call me in for the first aid, so I'll do the first aid training. I've also been very involved with our seniors and with fall prevention.
Okay.
So Alexis, our health educator, and I both went to Portland, Maine a couple years ago, and we took, it's a matter of balance. It's a recognized evidence-based program. We became master trainers.
Awesome.
So we have already done 2, and we had one scheduled pre-COVID that we had to cancel.
Yeah.
So those are the 2 main ones I do, but whatever pops up, if they need me to help, I'm available. I've also there are certain companies that may need a health education as part of like an insurance thing for their employees, and there's one in town. I've gone and done health educating things for them. I've also done some programs at the senior center.
Wonderful. And speaking of senior center, why don't you tell us a little bit about your hours there and what you do there?
Okay, so my normal hours again would be Tuesday, Thursday, Friday from 9:30 to 12:30.
Okay.
And I'm a wellness nurse, so I'm seeing our seniors. They will come in prior. Excuse me, let me fix my mask. Prior to COVID, it was walk-in, but now we can't do walk-in. They'll make an appointment with me. So it's blood pressure. Blood sugars, I have a glucometer, I can check blood sugars, questions they may have about medications or disease process or a test coming up. Sometimes someone will come in and they just want me to look at something. Do you think I need to let the doctor know? Right. They get my opinion. I'm always very clear to tell them, I'm not a doctor, but this is what I think. I have a real bond and a trust built up with many of them.
Right. Just like recommendations for diet and nutrition and things like that.
I mean, if it's a new diabetic, we can make an appointment. They can come see me. I can spend time with them. I had somebody, it could be diabetes, it could be another. If it's going to be more than a small chunk of time, they'll make an appointment, and I'll spend the time with them.
Wonderful. And then you also do a Parkinson's support group?
I do. That's one of my favorite things. A great, wonderful group of people. It's sponsored by the Connecticut Association of Parkinson's Disease. Yeah. And we meet as a group in the Senior Center the 4th Friday of the month at 10:15. We just started in August doing a Zoom program. Right. So hopefully we'll have more people attend that. The ones that did attend last month were very grateful. Right. And like I said, it's a wonderful group, and it's one of my favorite things that I get to do.
And it's for people that have Parkinson's, but also for their caregivers and their family members?
Yep.
Okay, and they're all welcome?
Yes, they're all welcome.
Awesome. And then you also do like vitamin B shots, and you can help with blood pressures and things like that?
Yes. The B12 shots, if the person that gets a B12 shot, a lot of them get them every month, and it's a real inconvenience to have to go to their doctor's office. So I can get an order signed by their physician. I cannot give meds without an order, but I can give this if they are, and I say, can they get this at the senior center? And they'll say yes, and then the patient will, not the patient, they're not patients, the member will come with their medication, and I will give it to them. And then I'll do a blood pressure check while they're there.
Perfect. And then if people needed help learning how to use any of their equipment as far as glucometers and things like that, they can come to you.
I do. That's something I do a lot. Like, I've got this machine, I don't know what to do with it. And or a blood pressure machine. A lot of people, the doctors are sending them home with electronic blood pressure machines. Okay. I'll help them make sure that they're using it properly.
Wonderful. Why don't we talk a little bit about the flu shots, because it's flu season coming up.
Yes, it definitely.
First question I want to just get to is, people always think that if you get your flu shot, it lowers your immunity. With COVID going on, I know that you have some recommendations.
Yes, so we are recommending, and CDC, everybody, all public health, that people continue to get their flu vaccine, especially this year. It's very important. There is no evidence that getting your flu vaccine is going to make you more susceptible to COVID-19.
Right. So get your flu shot.
Get your flu shot. If I can say anything, please get your flu shot.
Right. And I know that the Senior Center has some dates that they're offering flu shots to their members.
Yes.
So they can go on October 6th, 13th, or 27th and it's from 9:30 to 1. Do you know if they need to actually call and register for a time slot, or?
I think they need, I'm not sure about that.
Okay.
So I would suggest that they call the senior center.
Okay,
I don't know,
perfect.
do you want me to
No,
say
it's
that?
okay. We can put the number on the screen,
perfect.
and they can just call there and make sure if they need to register for a time slot. And then also for the public, I know that there is a public flu shot clinic.
Yes, we are doing a public flu clinic with a local visiting nurse association, and that is going to be at the Wallingford Public Library on October 17th, and that's 9:30 to 12.
Perfect. And then I know that we've just all been very cooped up since the quarantine and everything. What could you say that we should just do to keep ourselves mentally healthy, physically healthy? What are some suggestions and recommendations?
And we're all in different situations. I would
Absolutely.
say whatever a little bit of normal you can bring back into your life is important for your overall sense of well-being. I think getting outside, it's still beautiful. Even
Especially
if it's,
right now.
even if it's a little chilly, even if you can get out onto your porch and get a little sunshine, smell the earth, hear the birds. If you've got little children, this is a great time to go out and look at leaves and
Right.
get them in the dirt and let them feel that, just to feel normal. Exercise, healthy diet, staying hydrating, and staying in touch with your loved ones and your friends.
Absolutely, absolutely. All right, well, we have about 1 minute left. So is there anything else that you want to definitely reiterate or make sure that the community is aware of?
Just to make sure, continue, don't let your guard down. Let's keep wearing our masks, hand washing, and hand sanitizer if you can't wash your hands, social distancing, and just remember in Wallingford that our community is our patient, as our number one patient, and we want to keep Wallingford healthy and safe.
Well, thank you so much for coming today. This has been great. It's a lot of information that I think the public really needs to know, and just to keep us updated.
Thank you for having me.
You're welcome. Thanks again. Once again, I'm Stacey Hoppus, and I'll see you around town.